Welcome back. January is Thyroid Disease Awareness Month. So what should we know about thyroid disease?
Well, we are talking about it today with doctors from Fox Valley Surgical Associates. We've got Dr. Mitchell and Dr. Malik. Good morning to you both.
Good morning. Thanks for having us.
Yeah, Dr. Mitchell, let's start with you. How common is thyroid disease?
So thyroid disease is very common both in the U.S. and globally. So 1 in 10 Americans will have a thyroid nodule problem or a thyroid dysfunction problem. And these are typically related to either overproduction of thyroid hormone, underproduction, or development of thyroid nodules or thyroid cancers.
Okay.
Now, Dr. Malik, let's talk about the thyroid disorders that you treat most often.
Well, thyroid is a very small gland, but it does a lot in our body. And it can overproduce or underproduce thyroid hormone. And the most common cause for underproduction of thyroid hormone is Hashimoto thyroiditis, which is the autoimmune disease, and it causes inflammation in the thyroid gland. It is typically found in middle-aged women, but it can happen at any age. But as we grow older, the chances of having it becomes more. And because of the inflammation and because of the antibodies that prevent the thyroid gland to produce thyroid hormone, so ultimately thyroid gland is not able to produce enough thyroid hormone, so we need to supplement thyroid hormone.
What about hyperactive thyroid glands? Like, can people with that end up in your office as well?
Yes, the thyroid gland may become autonomous, or may have a small nodule in it, or some of the newer medications of a cancer medication can cause thyroid gland to overproduce thyroid hormone. And when the thyroid gland is overproducing thyroid hormone, it can affect any organ, all the organs of the body. So patients end up having tremors and racing of the heart, sweating, weight loss, foggy mind, and those kind of things. So yes, we treat those as well.
Now, Dr. Mitchell, let's talk a bit about the thyroid diseases that endocrine surgeons see in clinic.
Yes, so quite often I'm seeing patients that have thyroid nodules or thyroid cancers. So thyroid nodules are quite common. We see them a lot in women. So about 5% of women will have a palpable thyroid nodule. Another 20% will have a nodule that we could detect on ultrasound. So oftentimes we are following these nodules with ultrasounds or fine needle biopsies, and a small percent of them will be malignant or have thyroid cancer.
And let's talk a little bit about thyroid cancer, because if you catch it early, it's very treatable, right?
Yes, so fortunately thyroid cancer is very, very treatable. It is on the rise. It's currently number 6 most common cancer among women. But for the majority of patients, we're diagnosing them at lower stages. Overall survival rates are 98% in 5 years, and even at 10 years, survival is over 90%. So it's very, very treatable. The mainstay of treatment is surgery, either removing portion of the thyroid or all of the thyroid. If there's advanced thyroid cancer involving lymph nodes, then we also remove the nearby lymph nodes.
Okay.
It sounds like this small part of our body can have a major impact on our overall health, and the place to find more information and start that journey to wellness is through Fox Valley Surgical Associates. They provide care at 6 locations throughout the Fox Valley.
And you can find those locations at fvsa-wi.com. Call locally 731-8131 or toll free 800-574-3872. Thank you, doctors.
Thanks for having us.
Thank you.